And now, San Diego Connect.
I'm Bill Griffith. Due to widespread abuse, prescription pain meds are getting harder to obtain, and while that's good, that can lead to other serious challenges. Dr. Michael S. Duffy, Senior Medical Director of Pacific Bay Recovery, here to talk about that. Now, Doctor, let's begin with your recommended treatment for chronic pain, and it is not narcotics.
No, narcotics have a place in medicine just like other modalities in medicine. They just are not intended for chronic use. Anything beyond a couple weeks or a month type of thing, the dynamics within your body become a huge challenge. You adapt to these medications and you require more and more and more. And in order to have the same pain relief that you had with a very small amount initially, I have to actually cross the threshold eventually of overdose or potential overdose with these. Then I add other medications that you may be on at that point in time, like benzodiazepines, Xanax, and other medications, Valium. That unbelievably significantly increases the reasonable risk of overdose.
And of course, if that's taken away from you, the prescription drugs, you have scientific evidence that that can then be a gateway to things like heroin, maybe illegal, serious drugs.
Regrettably, your body doesn't know the difference between street drugs and drugs that are written in prescription.
Yeah.
Okay, so heroin and narcotics were narcotics.
Yeah.
When all too often at this point in time, as we've become acutely aware that chronic narcotics are really not intended to treat chronic pain except in rare cases, this has led to people having to go to the street because unfortunately they are addicted. This topic of dependence versus addiction, that's nice for medical textbooks and discussion. Regrettably, your body doesn't know the difference. And they will go to street drugs, and they do.
And they are cheaper, they are available. There's a whole mess there. We're going to talk about intervention in the next segment. But listen, if you know anyone who has treatment for any addiction or dependency of any kind, outpatient or residential, contact Pacific Bay Recovery by phone 858-263-9700 or pacificbayrecovery.com.